Hi, this is Dr. Jim Anderson from Anderson Podiatry Center, here to talk to you about Achilles tendon pain. And I'm specifically going to talk about Achilles tendon pain where the Achilles tendon attaches to the back of your heel. It's very common, and maybe in another talk we'll talk about the tendon up a little bit higher. But on the very back of the heel, oftentimes people come in, it's swollen back there, it might even look like they have a bony growth back there. There's different names for this, especially when it protrudes where the Achilles tendon attaches. It's called a Hagelin's deformity. Might be called a pump bump, like a pump shoe rubbing against the area. Kind of an old idea that would cause it, but that's one of the names that you'll hear. And in medicine we call it a retrocalcaneal heel spur. Retro meaning back of, calcaneal is the bone. So those are some of the terms that you'll hear. So what is happening back here? And I might say it's a very frustrating problem. And frankly, I get kind of frustrated with it because I feel that our treatment plans work really well. And we have many people coming in that have gone on for months. They've been icing it, they've been stretching, they've been doing lots of physical therapy. And we go about treating it, I think, a little bit differently because we believe the cause is a little bit different. But just a little bit of an anatomy lesson. Understand that the Achilles tendon attaches not on the upper half of the heel, if you look at it on the back, but from about the midway point here down. That's where it's attaching to the bone. So the problem isn't down there. It's usually on the upper half where the tendon rubs. And so we really think a lot of the mechanism of how you get this problem is as you walk, your heel rotates during your stride. You hit the heel on the outside. It's normal to strike on the outside of the heel. And then your foot rolls in. And then when you propel off, it rocks back. So you get this torsion in your heel bone. And we think that it's actually the torsion of the heel bone against the tendon. If my left hand is a tendon, this is what can cause a lot of the irritation. So much so that you can get friction between the tendon and the bone. That can create inflammation of the tendon. It can break the tendon down, and you can get a tendonitis. And then eventually you'll get even little microscopic tears. So we treat this oftentimes with orthotics, inserts in the shoes, custom made, can help prevent a little bit of that rotation, helps get rid of the cause. But the other thing we do a lot, and we do it a tremendous amount of the time if there's any tear, is we use regenerative medicine. We use what we call amniofix, and that's simply taking this product is simply from the placenta cells. Mothers donate the placenta after they've gone full term. It's FDA approved, very safe to use, and basically when we do this, we inject that area and it helps your body's stem cells be recruited to repair the tendon in that area. Very successful, very little layup, and I just want you to consider a lot of the options that we have that I feel have a very high success rate, and we're really treating the problem because a lot of you are coming in, you have been doing stretching, and you actually have a little bit of a tear. And that stretching probably isn't helping that, and you need a way to regenerate and repair the damage that you have to that tendon. So just be aware of that, and please give us a call or visit our website at AndersonPodiatryCenter.com.